Dr. ESK and all the team members of NeuroCrush TriMed for giving me this opportunity to be sharing this experience with all of you. David, at full term, uterine dystocia and prolonged labor were the indications for birth by Cesarean section. The postnatal period was uneventful except for mild physiological jaundice. It was around the end of the second year that the parents, mounting concern about the son not uttering even one meaningful word, took them to the specialist. David did not respond when called by his name. However, even as a 2-year-old, he would run to the TV to hear the familiar TV jingles, which he still seems to relate to every time with the same joy and jest. David was preoccupied with himself, muttered and showed poor eye contact. He was hyperactive and indulged in lone play. Bera, to rule out hearing deficit, and brain MRI to look for any structural lesions were done and reported normal. A diagnosis of ASD was arrived at by the specialist. Special schooling was initiated right away with emphasis on speech therapy and occupational therapy, and soon he could write numbers and solve basic level jigsaw puzzles. He has been with Vidyasagar for the past 2 years. Initially, he kept moving around the classroom with strong intolerance to sitting in one place. He showed no inclination towards academics except scribbling on paper and favoring the letter H and number 7 in the letter number picking exercise. With lack of meaningful words and phrases, David's self-learning is mainly visual and through observation. He repeatedly grabs a fevistic with attractive yellow label or a crayon, preferably green in color, objects to which he has an inappropriate attachment, as termed in ASD clinical jargon. Sameness seems to be the comfort zone. When asked to return the object, being of easy and flexible temperament, he returns it without a whimper, only to grab it the next moment. Occasionally, he has to resort to tantrums to get his way when caregivers seem unreasonable. With physical exertion in the dance class, his restlessness has been brought under a semblance of control, and with this, his attention span has shown an improvement. Attention is the first step towards learning, and the child shows some progress in activity-based learning as he sits through longer sessions with undivided attention. His restlessness continues to manifest at hand flicking and whistling intermittently. With physical assessment reports, the clinical specialist's observation, a general and clinical examination showed an intact systemic examination. The neuropsychiatric inventory revealed increased motor activity in the classroom, unintelligible sound by way of speech, grossly intact higher mental functions, and no facial deficits. EEG report, bilateral epileptiform dysfunction. DST, age of 3 years attained. ISAA score 94, indicating mild autism. CBCL, internalizing syndrome criteria for withdrawn, depressed, social problem and attention deficit. VSMS, social age of 5 years, 4 months and 8 days, obtained with a social quotient of 70, indicating borderline deficits in social adaptive learning. ICF neurodevelopmental disability assessment shows minor problems in mental function and no structural deficit. Under activity and limitation, significant problems in subdomains of learning and application of the gained knowledge, general tasks and demands, self-care, major life areas and community, social and civic life. Considering environmental factors, both parents and institution proved to be facilitators. Observations by Dr. ESK, Buzzi notes a curious attachment. One of the most outstanding symptoms of the autism spectrum is a curious attachment to objects. Perhaps part of the tendency to overinvest in certain activities of the suspense at the expense of the more normal pursuits, and attachment can be to a particular activity or even a particular person. I recall an interesting article by a doctor in the Journal of the American Medical Association titled Phantom of the Opera, in which she described her son's attachment to a particular piece of music, and to hear the same over and over again. Curiously, attachment to certain objects such as a teddy bear, even one that is moth-eaten or mangled, is a transcultural trait, childhood trait. Remember Mr. Bean and his bear? Anyone? Final notes, response to therapy by Dr. Yeski. David cooperated overall for the therapy except for some restlessness in the second session. At the end of the therapy, the overall improvement was significant. His mother wished to continue therapy. Reviewed 1 month after the therapy, his motor movement and coordination were better, and his repetitive movements reduced. His attention span had improved and his response better to classroom activity. Considered David has anger outbursts when pushed by his brother, which was considered a natural response to the provoking stimulus and was viewed as a positive sign both by the Buzzi team and the senior faculty of the institution. Thank you very much.